Welcome to this episode of the Harpreet Singh Show. I'm your host Harpreet Singh from Surrey, British Columbia, Canada. In today's program, we'll be talking to two professionals who will be telling us as to how we can empower healthcare professionals through simulation-based education. We have with us Kathy Kennedy and Michel Kearns from BCIT. So let's welcome both our guests and continue with our discussion. Kathy and Michel, welcome to the program.
Thank you for having us.
Thank you. It's a pleasure
Thank
having you
you.
both of you. So, Kathy, we would like to learn from you about how healthcare professionals are being empowered through simulation-based education. But before that, just a brief introduction about Kathy is. Kathy Kennedy is the Associate Dean for Specialty Nursing in the School of Health Sciences at BCIT. With over 25 years of education and clinical experience, Kathy developed a passion for a variety of simulation deliveries to enhance the learner experience and better prepare them for the challenges of the clinical environment. Kathy's interest in simulation led to the original development of the Virtual Pulse application. She continues to advance this application as a co-lead of the Virtual Pulse product. So Kathy, before I ask you some questions, we would like to see what kind of work has been done and is being done by you. So let's start with this video which tells a little bit about Virtual Pulse.
Ease Virtual Pulse. Creating a safe environment where nurses can learn from their mistakes. Providing unlimited access to high-risk, low-frequency cases difficult to simulate in the lab. Facilitating effective pre-brief and debrief sessions. Creating similar experiences for both distance and on-campus learners.
Take a mask over the mouth and nose.
Connecting students through collaborative group work.
And this is actually a difficult case.
Supporting our learners at clinical sites.
Let's see what like you can only squeeze the left. All right.
And increasing the confidence and competence of our learners. Virtual Pulse, 20 cases and growing. Reuse potential for other programs and future applications. Dedicated team members to keep things pumping. Virtual Pulse, transforming healthcare education.
So Kathy, in this presentation, we come to know a little bit about what kind of work is done by you, but tell us a little bit first about your specialty nursing school at BCIT. So since when it has been working and what kind of services are provided?
Sure. So the specialty nursing at BCIT has been around for about 35 years now, and we have 11 different specialty nursing programs ranging from critical care to emergency department to working in the neonatal ICU, birthing babies and the perinatal and the peri-op programs. And so we offer specialty education for nurses. They're already nurses and now they're looking to come back and work in a more specialized environment.
Oh, that's wonderful. So, like as technology is developing, lots of advancement, and we see through simulation-based education now, you're trying to give them the knowledge, what is required, and especially during this pandemic we have seen, when we could not be face-to-face. What was this idea behind starting this? Because you started this about 5 years back, and how has it helped the healthcare professionals?
Yeah, excellent question. What happened for us, I think that we have found with our learners is that even though they go into the clinical environments, so for example, we have a pediatric emergency nursing program, and when they go into the clinical environment, they may not see all the different kinds of things that come in to an emergency department in the time that they're doing their clinical. So it was so important for us to make sure that our learners were exposed to a variety of different cases. So an example might be like a child that is in a house fire. And, it's really important that our nurses know how to deal with those kind of scenarios, but the entire time they do their clinical rotation in school, they may never see that. So it's a low frequency thing, but it's very high risk. So it was really important for us that we started to create scenarios so that our learners were exposed to all different kinds of opportunities and clinical presentations. And then when they come into the clinical environment and graduate, they have had those experiences. And it's very empowering for them to at least have had the opportunity to move through that.
Mm-hmm. And what has been your experience, like real hands-on experience and simulation-based education? Are there any challenges that you have been facing?
Yes, certainly. With our simulation, I think the most important part was that we weren't going to go down this road with Virtual Pulse if it wasn't realistic enough. And so we needed to make sure that we worked with animation specialists and we worked with programmers and our subject matter experts to make sure that the simulations were as real as possible. You could see all the subtle changes in the patients. And the one thing we still, the technology still has yet to help us with is that hands-on tactile, that touching of the patient. And so you're right, we got very close, but we still don't have that hands-on. So we need to make sure that we do these simulations in connection with actual clinical experience.
Mm-hmm. And Kathy, of course, with the kind of technology advancement that we are seeing, definitely that also time will not be far when those things what are not available now will be available later on also. So when you talk about conferences like CINI, where you spoke recently, we had professionals from all over the world who participated in the conference, and the focus was on integrative medicine. The best of the East, the wisdom of the East, and the modern science of the West, when they come together, it can produce wonders. And the way things are happening in the world right now, what is your opinion about it? How can integrative medicine help in furthering education as well as providing better health to the patients?
Yeah, it's a very good question, and I think it's really important that we think about how we integrate all different kinds of philosophies and healthcare when we're caring for patients. And so when we're posed with a problem that we've all got right now with regards to COVID, there are different countries that are tackling, we all have slightly different approaches and different ways that we're providing care for our patients. And it's really important that you bring all those pieces together and you look holistically at what we're doing with our patients. And so one of the things that we've really appreciated with Virtual Pulse is that we incorporate all of those. There's an emotional attachment to the patient. You'll see later when Michel presents that we've made sure that the learner's feeling everything. They're hearing the environment behind them, they're hearing the patient, and then they have that proper follow through, where they're able to get feedback and understand, where they went wrong.
Mm-hmm. So let's get Michel Kearns also on board and learn from her experience also about this Virtual Pulse application. Michel Kearns is the Manager of Simulation and Experiential Learning for the School of Health Sciences at BCIT. She has been working in the field of education and training for over 3 decades, designing, developing and facilitating simulations, games and experiential learning activities. Michel is currently a co-lead and one of the original developers of the Virtual Pulse product. So Michel, once again, welcome, and it's a pleasure having you over here today.
Thank you.
And before I continue discussion with you, let's see a video where you try to explain about this simulation product. So let's see this video first.
Virtual Pulse, a highly interactive web-based virtual simulation application containing immersive clinical environments. With realistic patient sounds and movements, and access to a comprehensive range of assessment and intervention options. With information such as patient history, lab, and other diagnostic results. And fillable forms for documenting assessment results. Virtual Pulse includes those patient interactions difficult to replicate in a physical simulation lab. Supported with responsive feedback, the application will not compromise on patient or practitioner safety. Clinical feedback that incorporates principles of gamification increases learner engagement while encouraging improved performance through repeated practice, enabling healthcare professionals to acquire critical knowledge and skills in a safe learning environment. Virtual Pulse, transforming healthcare education.
That's interesting. So, Michelle, you're an expert in designing, developing, and facilitating simulations. What is the future of this technology?
Well, the future of this technology is very exciting. We're looking at things like artificial intelligence to help us with some of those communication aspects. Right now in our application, we can ask the patient questions, but it would be so much more rich if we could use artificial intelligence to be able to do that. We also want to and have been working with augmented reality and virtual reality applications. So we can take these same patients that are currently in the web-based environment and we can bring them into augmented reality and virtual reality. Not only just the learner to the patient, but we're also looking at multiplayer applications. So it's quite exciting to see where this is going. And also, as Kathy mentioned, and you mentioned, Harpreet, that haptic technology is getting better with these technologies. And so we'll be able to actually feel and touch things.
Right. And this is for teaching purposes, but do we also see in the future that we'll have a time when actually a patient is in the room and through this simulation, the students or the healthcare professionals sitting at their homes using the technology can scan and can work on the patient?
Absolutely. We would look at making the learning outcomes a little bit different and modifying it just a bit, but we could use this as two different ways in addition to this. Number one, a patient can access this from home, or the patient can actually work with a healthcare provider and it's kind of sit side by side like a laptop or a tablet and go through some of the things like, oh, this is what's happening inside. We do see hospitals now using virtual reality to help with things like anxiety or getting people to see what does it look like inside my body, because we can't always see that. So there's certainly great potential there.
And Kathy, what has been the response from the students with this technology being used? What are you finding out with your experience since the past 5 years, and especially during this pandemic when there was no face-to-face conversation? What was the response from your students?
The students have been, it's been fantastic actually. And this gives their students an opportunity to practice things and what we call safe fails. So they can say, well, what happens if I give them this medication? Or what happens if I give too much of something? And then they're able to go through it, practice it. And it's very powerful, very empowering for our learners to see the outcomes with zero risk to patients. And the students have loved it. We've been able to create scenarios that they can try things over and over and over again until they get a successful outcome.
And Michelle, what else is happening? What else are you focusing on now?
Our biggest focus right now is that multiplayer, because we want to look at interprofessional education. We want to bring in that physician from another country or another province, and we want to bring in other healthcare providers so that we're all working with that patient and having that true patient-centered care. So multiplayer virtual reality.
Okay. Kathy, tell us a little bit more about your School of Health Sciences at BCIT over the years. What are you observing? What is the intake of the nurses who are coming over there, and in which particular field are they basically more interested now?
Certainly with COVID, what has been very, I would say, inspiring is to see that we're having a huge increase in our applications for learners wanting to become nurses. So in our basic nursing program, and then also an intake like an uptick in nurses wanting to become more advanced in critical care and emergency. And it's interesting because I think during the pandemic, there would be a concern that there weren't people that were wanting to move towards that profession. And in fact, I think that there's a significant amount of the population who are really wanting to feel through COVID that they want to help. And there's things, they want tools and they want to be able to move into the profession of nursing so that they can provide that kind of care. So it's been a really interesting and positive outcome, I think, of COVID.
And Michelle, Virtual Pulse, this technology that you're using, is it only at BCIT or is it being used at hospitals and other places also?
Currently, it is being used across Canada, and actually, with one of the other earlier versions, it's worldwide. Kathy, maybe you can talk a little bit more about the Fast Track program that uses the same technology. The FATMAP.
Certainly. So when the pandemic first started over a year ago, we designed a quick course called the FEPA program, and it was a focused education preparing and advancing healthcare workers. So it was just giving them some quick tools to be able to work in these acutely increasing environments. And so up to date, we've had over 12,000 learners across Canada and some in the United States and internationally who've taken this course. It doesn't make them critical care nurses, but it gives them tools. And within that, we embedded virtual pulse. And so it was an opportunity for them to care for COVID-type patients and patients that were compromised with their respiratory system and so on in a no-risk environment. So it gave them a little bit more of that theory to practice application.
So Kathy and Michel, I would not be wrong if I say that BCIT is a pioneer in empowering healthcare professionals through simulation-based education. Are there other companies also like yours which are providing these kind of services?
So
in the
I'll
virtual
jump.
simulation world? Yeah. Oh,
Go ahead,
Kathy.
Michelle. So
I was going to say there are other. I'm going to let you go, Kathy.
Okay.
I think there are some products that are out there, but what we have certainly found, and feel free to add to this, Michelle, is that the realistic approach that we really needed within Virtual Pulse is unique for BCIT, and also our ability to customize different case scenarios. But Michelle, feel free to add.
That's exactly what I was going to say, and I love the fact that we're able to take some of those same characters and move those into AR and VR, which some other organizations aren't able to do yet at this time.
Wonderful. That's really great. So, Kathy and Michelle, thank you very much for your time. It was a pleasure learning from you as to what is being provided for healthcare professionals, and the future of simulation will really lead to wonders and help out the healthcare professionals learn and experience and have that experiential knowledge before even they touch the patients. So in conclusion, if you would like to add anything which I might have missed.
I think just one last thing is that we're very excited about the idea of having more of a global reach, to other countries and, other experiences for our learners. And so we have these amazing simulation labs at BCIT, but not everybody lives in Burnaby and BCIT near our campuses. And so this type of approach provides that opportunity for anywhere in the world to be able to have that same experience. And I think we just feel really passionate about that as healthcare providers.
Great. And if anybody wants more information, any healthcare professional wants to know more about it, any website or any email where they can contact you? Absolutely.
If they can contact myself, and I can tell you it's mkearns@bcit.ca. So mkearns@bcit.ca.
Great. It was a pleasure talking to both of you. Thank you very much for your time and best wishes. And we hope this technology further helps out the healthcare professionals. Thank you very much.
Thank you.
Thank you.
Thank you. So these were our guests for today, Kathy Kennedy and Michel Kearns from BCIT, who told us about how this healthcare professionals are being empowered through this simulation-based education. And we would also like to congratulate Dr. Arun Garg and his entire team of CINI for organizing this conference and getting these kind of personalities over there who are sharing their vision of better healthcare. And as you all of know that Dr. Garg and I co-host a program every month on the second Tuesday where we have people from different professionals, medical professionals coming over and talking on various topics, sharing their expertise which can help us live a better life. So once again, thank you very much to all the viewers for sparing your time and watching this program. You can, every evening from 7 p.m. onwards, Monday to Friday, I have different guests and we talk about different topics. So if you also want to be a part of this program, you can contact me at 604-603-7555, or you can email me at harpreetsingshow@gmail.com. Thank you very much. Have a safe evening, stay healthy, and enjoy yourself.